A lot of patients seek us out specifically because when they're looking in the mirror, they feel like they look tired, particularly around their eyes. Oftentimes, the source of their tired looking eyes is excess skin, misplaced fatty tissues. So, with blepharoplasty, we can go in and we can tighten the skin, we can smooth out the contours around the eye and eliminate bags underneath the eyes or hollowing. And those things typically make people look much more well rested, make people look much more awake. For a lot of our patients, that's their main complaint when it comes to the area around the eyes. And blepharoplasty is an excellent option to turn back the clock in that area. Patients that can be good candidates for blepharoplasty are those that notice that they have excess skin on the upper eyelids, notice that they have bags underneath the eyes that they would like to have treated. If patients have a history of eye disease, i.e., glaucoma, or significant dry eye, or have had recent surgery to the eyes, those may be red flag issues that we would have to discuss as to whether or not you might be a candidate for the procedure, or you may need to wait some time before you can undergo the procedure. Generally, these are very safe procedures, and so even if people do have a medical history of eye conditions or other medical conditions, we can work around those. But that would be something that during a consultation we can go in depth about and discuss the relative risks and benefits of. Blepharoplasty is performed basically directly through the eyelid, generally. For the upper eyelids, we make some micro incisions through the eyelid skin and direct the incision in the crease of the upper eyelid. So when your eyes are open, the incision is completely essentially hidden. For the lower eyelid, we typically make an incision on the inside of the eyelid. So that allows that incision to also be camouflaged. We'll typically laser the skin in various areas to help tighten it up. And what we see with doing these procedures is essentially an undetectable access with a high impact result that allows the patient to feel better about themselves and look more rested, more awake, and more satisfied. Certainly, with blepharoplasty, there are risks. The greatest of that being dry eye issues. So, certainly during our consultation, we would discuss that, and we usually see the patients have a little bit of increase in their dry eye symptoms after surgery for a short period of time and may have to use additional drops. But this would be something that would be probed during your consultation. Additional risks would include bruising, swelling, and sometimes there can be eyelid malposition, although that's quite rare. Typically, we see that patients do very well with these procedures and they are quite low risk as far as procedures go. Typically, with upper eyelid blepharoplasty or upper eyelid surgery, we might see that a patient is able to return to work essentially immediately and may have minimal bruising. Typically, the incisions are hidden in the crease of the upper eyelid, and so even the sutures are difficult to identify. We do want patients to do some icing and resting, especially for the first day or so, to allow for the healing to occur. For the lower eyelids, that can definitely be a little bit more of a recovery process. We want people to reduce their eye strain and ice and provide some cool compresses potentially to the area as well, which typically is going to help with the swelling and the bruising and allow them to heal quicker. We do like to see patients take about 5 to 7 days of time off if we're doing the lower eyelid, especially in order to let the area heal completely so that they can heal as fast as possible. If someone is interested in learning more about our practice and what we do, certainly visiting our website at sandplasticsurgery.com. We have hundreds of before and after pictures. We have hundreds of patient reviews on our site. We also have a library of information on there regarding each of our procedures that we perform in order to get some information. Additionally, on the website, we have consult request forms that you can fill out, and our team will get right back to you if you seek that out.